Good day, everyone, and you are welcome to our last video on CHCAGE011, which is providing support to people living with dementia. If you are just joining us, we have 5 previous videos. Please take your time and watch them while you join us on this. That will give you much information about what has happened and how we have gone over the period of time. So having provided all the support, all the services that is required of us in line with our organization policies and procedure, the next thing is for us to document this task or these activities we've done appropriately. If you know, there's a saying that if we don't document, that means it's not done. So it is very important to keep details of the record of the care that we provide for the older person or that they've received, and this really helps the system as well as other workers to provide better care for that particular person. And most of the time, of course, these are some of the information we use during handing over. We can put them, some of them, in our progress note, so that other people can know what we've done and how best we can support our client. So providing proof of care is needed by court or family member sometimes if there is some challenges with the service that we are giving. If we are able to get all this information and we are able to show them this is what we've done as a so date, and this is how we've done it, this will of course give them a clarity of what services we're rendering to their loved ones. It also helps in tracking the person's medical and behavioral changes. This is a very important part of the job that we do, because when we observe there is a changes in someone's behavior, we are expected to of course raise the flag, because a change in behavior can be some kind of illness. Failure to document this particular behavior can compromise the level of care that we are providing. So as a care worker, our team will be relying on us to say whatever we've observed, and not just saying it but document it appropriately in line with the organization policies and procedure. There are a few conditions and indicators that we should also be aware of, like if someone has injury, probably there's a swelling or bleeding, or even they are not really working well. You say there's a scrap, or so we need to raise this flag to our supervisor. If we observe that there is infection, whether our client is having shortness of breath or loss of appetite, or even they are feeling feverish, or we can say there is a weight loss due to illness, all this information needs to be documented and reported appropriately. And probably during the ADLs we observe that there's some redness in some areas, or they are very sensitive to touch due to pain, or they are gripping because of supporting them in that area. We should inform our supervisor immediately so that this can be addressed. So you as a care worker also need to recognize how the condition impacts the person's behavior, and how that makes the person feel uncomfortable. This discomfort can cause sometimes negative reaction or behavior towards you. Just try to understand this, because of the pain, and sometimes they are confused, they don't know how to tell you what you are going through appropriately, thereby instead of them the next thing they resort into is to lash out. So we should understand that it's not them, but the pain or the diseases that's really causing this kind of behavior. So reporting can also be done in two ways. Either we inform our supervisor by just getting up there and telling them face to face what we've observed, and seeking for their direction on how to handle it. Or we can, after verbally reporting, of course, we are expected to write a report to document what we've observed as well. Because sometimes, of course, when you just talk about it, if you don't document it, others will not be able to, they won't have that information, and it will be very hard to be able to track. But the moment you document it and you save the copy according to your organization policies and procedure, other people that is supporting that particular client, they can use it as a reference on how best to look after that particular client going forward. So completing, maintaining, and storing documentation according to organization requirements is very, very important. This keeps a good record of the important job that we've done, and it allows us to access necessary information and share them when needed. Completing documentation means having a record of important information about that particular person. This can include details about their family and other carers, medical records, individual plan, any report about that particular client, to mention but few. All these are very important information that needs to be stored appropriately. So, importance of accurate, objective, and details record. For a report to be useful to anyone who, of course, is in need of it, they need to follow this criteria. One, it has to be accurate. That is, your report must provide the exact narration of what happened, what you believe you've observed. Everything needs to be logical and needs to be documented appropriately. Other than that, it has to be objective. That is, it means to stick to the fact. You don't perambulate, or you don't guess. Whatever happens, you need to be exact what happened. So it has to be factual and detailed. Your record must contain all the appropriate detail of the event, like where it happens, who is involved, what step you've taken, and once all these documents are provided, we should not forget there is the privacy right of that person to keep such information very safe, keep them to themselves. It means that they have control over what happened or what information they want to share. We need to, of course, inform them about confidentiality as well, which is our responsibility of keeping a person's information private as much as possible, in line with the organization policy and procedure, and in line with the Privacy Act of 1988. Care provider must ensure to keep all this record, and outsider must not gain access to this record without the permission of the or the consent of the person themselves. That is what the law is all about. That is what the Privacy Act is all about. The Privacy Act 1988. It's a legislation that protects people's private information. It applies to Australian and all ages, and it contains the 13th Standard Privacy Principle that care provider must follow at all times to ensure confidentiality. According to the Part 3, Division 2, Section 16B of this Act, expression includes situations where information necessary is necessary to provide medical care, or this information is necessary because it's affecting public health or safety, and providing information is necessary to keep the person safe. This is the only condition whereby we are exempted to seek the person's consent before we provide the information. Whatever information we collected in line with Privacy Act 1988 must be fully stored accordingly. But in situation where that information is needed by for a medical care, or is needed for public health and safety, or even to keep the person safe, in those situations we will need to give such information out. Of course, our responsibility as a care worker is to maintain the privacy and confidentiality at all times, as I said earlier, and we need to strictly follow the organization recording policy, not keeping personal copy of older people in our home personal phone or in our own record, not sharing this information to anyone outside the organization, and not uploading the older people's record anywhere online. Yeah, in some situations we've seen this in the past. Please make sure you don't do it. Not just try, but make sure you don't do anything of such. According to the different opening disclosure framework, provider must disclose the following: failure to provide adequate care, instance of abuse from staff members, and instance of serious threat to person or others. All this information has to be disclosed appropriately in line with your organization policies and procedure. That's actually the end of our video. CHCAGE011. Thank you so much for your time, and I will see you in our next video. Till then, remain blessed. Bye for now.